Thank you very much, Sarah, and thank you, everybody, for being here. Andreas, Secretary Beam, Lindsay, thank you for being here. And thank you all for joining us. I'm pleased to be here today to mark an important milestone in our rollout of the vaccine and the process. As of last week, the Federal Pharmacy Partnership, which is the federal government program for long-term care facilities, that's all the skilled nursing facilities participating in the partnership, that they have all completed their first dose clinics. Walgreens has completed first dose vaccinations at close to 100 locations, and CVS, you'll hear from in just a minute, has completed first and second doses at all their participating skilled nursing facilities, which is more than 500 facilities in Pennsylvania. 100% of personal care homes and assisted living facilities covered through the partnership have completed their first vaccinations, 100%. This is an important milestone for Pennsylvania, and it marks key progress in ensuring that our most vulnerable residents get the vaccines soon and quickly. More than 150,000 doses of vaccine have been administered to residents, and more than 140,000 doses of vaccine have been administered to staff members who live and work at these facilities. Altogether, we know that more than 300,000 vaccines have been administered to skilled nursing facilities, personal care homes, and assisted living facilities covered under the partnership, the federal partnership. So we're fortunate to have excellent partners working with us to achieve this milestone. They've been great, and I'd like to thank the leadership and the workers, and you'll hear from CVS in just a minute, but the leadership and workers at CVS and Walgreens for all of their hard work to help Pennsylvania protect our most vulnerable Pennsylvanians. The point is, skilled nursing, personal care, and assisted living facilities have been hit very, very hard by this pandemic. And that's why this milestone is such an important one. The Federal Pharmacy Partnership is saving lives, it's protecting residents, it's protecting staff while giving families peace of mind that their loved ones are safe. And essential workers in these facilities can come to work confident that they're not at risk of getting the virus. Partnerships like these are crucial to the effort to get the vaccine to everyone who needs it and everyone who wants it. Pennsylvania has one of the largest populations of older adults in the nation. And we have more facilities working with CVS than any other state. Again, more than 500. It's true that not every resident and staff member offered the vaccine has chosen to receive it. Ultimately, vaccination is a personal health decision that needs to be made by individuals in consultation with their own doctor. But I cannot stress strongly enough how important the vaccination is. Vaccines not only protect you from serious illness and death, they also help slow the spread of COVID-19 to people around you who might not be protected yet. CVS has finished first and second dose administration at all skilled nursing facilities. And both CVS and Walgreens expect to finish first round vaccinations in participating personal care and assisted living facilities by the end of the month. CVS and Walgreens will continue to work closely with facilities to administer second doses. And they'll do that and to provide the vaccine to new residents and staff members in the coming weeks and the coming months. I know that the wait for more vaccine is long and hard for all of us who are waiting to get vaccinated, all of us. But we are making good progress, vaccinating the most vulnerable among us, and that's important. And the sooner we can reach this population, the sooner we can make the vaccine available to all Pennsylvanians who are the next ones in line. In the meantime, every Pennsylvanian should talk to their personal doctor about their COVID-19 risk profile. They should determine when it is they'll become eligible. If you're not sure when you'll be eligible, you can go online and use the Pennsylvania's Your Turn Vaccine Eligibility Tool. With this tool, people who are not yet eligible for the vaccine can sign up to get notification when they are eligible. 1 year ago today, we had not yet, it's hard to believe this, a year ago today, we had not yet detected the first presumed positive case of COVID-19 here in Pennsylvania. Now we have 2 safe, effective vaccines with more on the way. And we've completed vaccinations for some of our most vulnerable populations. We still have a long way to go, but we've made tremendous progress in less than a year. And as we reflect on the rise and fall of cases, fall actually of hospitalizations, of deaths over the past year, We need to take stock of both what has gone well and what has gone poorly so that we can learn from our mistakes and improve our processes. Most of all, we need to remember that there is hope. Though the constant grind of a global pandemic has worn all of us down and has frustrated each and every one of us, the progress we are making with the vaccine gives us all hope for a brighter future right around the corner. We'll continue to build our vaccine distribution process to make it work better for Pennsylvanians. And together, we'll get to that bright future when we spent the last year, all of us have spent the last year searching for. So thank you for everything, for all your patience. Pennsylvania, we're getting there. Now I'm going to turn this over to Andreas Chandra, who is the district leader for CVS Health. Andreas.
Thank you, Governor Wolf, and good afternoon. My name is Andreas Chandra, and while I'm here today as a district leader at CVS Health, I'm also a licensed pharmacist and authorized immunizer in the Commonwealth. Alongside many of my colleagues at CVS Health, I have had the responsibility and privilege of providing vaccinations in long-term care facilities in the Commonwealth to our most vulnerable populations. I'm honored to be here today to provide an update on the progress we've made thus far in those long-term care facilities across Pennsylvania. Our trained and state-certified healthcare professionals, pharmacists, and pharmacy intern immunizers are proud to be among the thousands of CVS Health professionals across the country helping to vaccinate seniors against COVID-19, bringing peace of mind to patients, loved ones, and to the larger community. We have a commitment to help protect the population disproportionately impacted by the pandemic. I'm proud to say we've completed first and second doses in all of our skilled nursing facilities with more than 200,000 vaccines given. That's more than 500 completed facilities throughout the Commonwealth, whose residents and staff who chose to receive the vaccine are now able to say today that they are fully vaccinated. We're also on track to complete the second dose of vaccinations at more than 1,800 assisted living or other long-term care facilities in the Commonwealth by mid-March. I can tell you firsthand the impact this effort is having on residents and their families. A store manager of mine was able to volunteer to help support a clinic in our area and was able to hold her grandmother's hand for the first time in almost a year as she witnessed her being vaccinated for her first and second dose. We are honored to be part of the solution to the greatest public health challenge of our time. And in partnership with the Commonwealth, we are determined to do all we can to help ensure that everyone who wants to be vaccinated can be vaccinated. Thank you, Governor Wolf, for inviting us here today and for your continued partnership. With that, I'm now pleased to introduce Acting Secretary of Health, Allison Beam.
Good afternoon. Thank you, Governor Wolf and Andreas, for joining us today. We have a tendency, as we battle COVID-19, to focus on the negative. Today, we take a moment to acknowledge the good news, the hard work of many people across the state providing vaccinations to some of our most vulnerable residents and the staff who care for them. As Governor Wolf said, we are not finished with the long-term care vaccination mission. In fact, each facility will have at least 3 vaccination clinics so we can ensure that as many residents and staff who want to get vaccinated have the opportunity to do so. Some facilities actually even have more than 3 clinics scheduled. This way, if someone declined the vaccine in their first or second opportunity, they'll have another chance to get the entire vaccine, both doses. This was just the first part of the long-term care vaccination mission. Going forward, we will want to maintain consistent vaccination levels at all facilities by ensuring that new residents and staff get vaccinated right away. We know that some facilities already have existing relationships with local pharmacies or other healthcare providers to take care of ongoing vaccination needs. We do not intend to disrupt that relationship. Rather, we'll be working with other facilities to make sure they establish similar arrangements. Maintaining vaccination levels in the long-term care arena will be an ongoing process. As I have said, I know that we have a lot more work to do. I know that tens of thousands of Pennsylvanians are getting vaccinated every day. But we are not satisfied. Because of the extremely limited supply, so many people are having a difficult time getting the vaccine. We hear it, we feel your frustration, and I can tell you that every single day, our Department of Health is making improvements to help increase access to the vaccine. Some of those actions are incremental, like improving communications with vaccine providers. Every day, we are on the phone with providers to help them understand how limited supply of vaccine is allocated, or reminding them to get first doses of vaccine into arms and reported as quickly as possible, or encouraging them to reassure their patient that second doses will be available for everyone who receives the first dose. Some of the changes we are making are having a bigger impact. Last week, I told you about the plan and changes we are implementing to correct a problem that could have jeopardized second doses of Moderna vaccine. Because of the swift action we took, in consultation with the Joint Legislative Task Force on the COVID-19 vaccine, I can assure you that if you received a first dose of Moderna, you will be able to get the second dose from that same provider. While the winter weather emergencies across the country last week delayed the delivery of most vaccine shipments from the manufacturers to the providers, we remain committed to making the adjustments announced last week to smooth out the overdemand for second doses over the next couple of weeks. This is a temporary adjustment, and we are making it to ensure that the second dose of vaccine is secured for you. Another change we made less than 2 weeks ago was the launch of the Your Turn tool. It's able to help folks understand where they fit into the vaccination plan and to prepare them to receive the vaccine when it is their turn. Lindsay Malden is going to provide some details about that, and I'm pleased to see the number of people taking advantage of this tool. With that, I'll turn the microphone over to Senior Advisor for COVID-19 Response, Lindsay Malden, to provide an update on the latest vaccination numbers and the Your Turn tool. Lindsay?
Good afternoon. Thank you, Governor Wolf, Andreas, Secretary Beam. Here's today's update on the COVID-19 vaccination effort in Pennsylvania. Despite the winter storms that affected much of the country last week and delayed nearly all shipments of COVID-19 vaccine, providers in Pennsylvania administered more than 2 million doses. In fact, through February 22nd, local vaccine providers have administered 2,034,123 doses of vaccine. 80% of first doses have been administered, and 42% of second doses have been administered. That means that nearly 1.5 million Pennsylvanians have received their first dose, and nearly 600,000 people have received both doses and are now fully vaccinated. We know that that number is actually higher, as Secretary Beam said. We are working with providers every day to make sure reporting is kept up to date. This week, Pennsylvania has been allocated 225,890 first doses of vaccine. That is the highest single-week allotment of first doses Pennsylvania has received so far. It is an increase of more than 42,000 doses. Pennsylvania vaccine providers are also receiving 180,610 second doses of vaccine. That is also an increase of nearly 40,000 second doses. In addition, the federal government is sending tens of thousands of vaccine doses directly to some pharmacies and federally qualified health centers who are helping to vaccinate more Pennsylvanians. And remember, the Philadelphia Health Department receives its own separate allocation of vaccine. That makes well over 400,000 total doses coming into Pennsylvania vaccine providers this week. Keep in mind that if all of the doses that were delayed by the weather last week will also be delayed this week. As Secretary Beam mentioned, no one here is satisfied with every aspect of the vaccine rollout. We are continually working to improve our processes and do all that we can to get people vaccinated. We know that right now there simply is not enough vaccine for everyone who wants it. That's why we created the Your Turn tool. So far, more than 180,000 people have registered by providing their contact information in the Your Turn tool. In addition to finding out when it is your turn to get a vaccine, the Your Turn tool allows people to register to receive updates about vaccine distribution and allows the department to let you know when it is your turn to get vaccinated. We're also looking to add more functionality to this important resource in the near future. Keep in mind that Your Turn does not schedule people for a vaccine appointment, but it allows for individuals to submit their email address to receive future updates related to vaccine opportunities when there is more vaccine available. If it is your turn, you will be directed on how to find a vaccine provider. If someone does not have access to the internet to use the Your Turn tool, they can call 877-PA-HEALTH to speak with a representative to determine eligibility. If eligible, the representative will help the individual find a vaccine provider near them and provide contact information to make an appointment. The virus remains a very real threat, and one we must take seriously by following existing mitigation orders and continuing to test. Ultimately, all protective mitigation measures, testing, and vaccinations work in conjunction to provide a safe and healthy Pennsylvania. We must have patience, as the amount of vaccine available in Pennsylvania and across the nation is extremely limited. While we continue to vaccinate people in Phase 1A, we must keep up our efforts to stop the spread of COVID-19 by masking up, washing up, and maintaining social distancing. Thank you. I'll turn the microphone back to Governor Wolf, and we'll take questions.
Thank you, Lindsay. And we're going to take questions now from reporters on the call. We ask that you please use the raise your hand feature on Zoom, and I can see you're already using that, which is great. So we will call on you, and then I'll ask you to unmute and ask your question. Could you hear me there? Sorry, that's I asked you to unmute, Aaron.
Oh, yes. Hi. Can you hear me? Has the state determined whether the snowstorm will prevent it from fulfilling those delayed second shots within 3 weeks as planned?
I'll turn it over to Allison, but I was on a governor's call this morning with the White House, and the snowstorms throughout different parts of the country did delay by a couple days, but I think they figure by Friday they should be all caught up just with this week's allocation, and then it'll be right back to normal. I don't know anything did I get that right? Yeah. Okay, so no, a little bit of a delay, but a couple days.
So the second shots will still be able to be within that 42-day period that's blessed by the CDC now.
Yes.
And we heard that the state offered providers Pfizer first doses this week instead of Moderna ones. What made you decide to do that? How many providers took you up on that offer? And what impact may that have on getting back on track with those second doses?
I'm not sure. I'm going to turn that over to the Secretary of Health.
Thank you. And to the question about Pfizer as first doses. So the way that the allocation actually works is that providers tell us what they're capable of handling. And so, as folks know well, Pfizer has more complexity around its cold storage that's required of it. And so we often survey providers to understand whether or not they're able to handle Pfizer doses as their first doses. We still stay true to having the second doses be corresponding with the first doses allocated the previous 3 to 4 weeks ago. But as far as first doses go, where providers have that flexibility and can accept either Pfizer or Moderna, that flexibility is good to know for our strategic allocation to get first doses out as quickly as possible.
Last week had an increase in our allocation over what the prior week, but Moderna did not. Right. So, okay.
Next, we have Crispin Havener from WJAC. Go ahead, Crispin.
Thank you, guys. Do we have any idea at this point when, given the fact that we are seeing the increase in doses eventually coming through here, do we have any idea of a timeline as to when we would move from 1A to 1B? And also, as we are talking about nursing homes today, I know there has been some talks from Republicans, especially some Republican Congress people who are asking Attorney General Shapiro to launch an investigation into how nursing homes were handled, similar to what was done in New York. Would you support anything like that being done in Pennsylvania?
So, Crispin, two questions. The second question is, I mean, I want to be as transparent and open. If there's something that we can learn from anybody taking a look at what we're doing, including the press, would welcome that. I think we're doing a pretty good job, but we're always looking for ways to improve, and that really requires that we allow people to come in and take a look at what we're doing. So, yes. Tell me again the first question.
Any idea when the state could possibly move from 1A to 1B? That could be for you or for the acting health secretary.
Yes. We are moving as quickly as possible. Do we have a time when we think we could move beyond 1A? Just keep in mind 1A is everybody 65 and older. We have over 4.5 million Pennsylvanians who are in that category, and we've gotten, 3 million vaccines at this point. If you have 4.5 million Pennsylvanians each needing 2 doses, that's 9 million vaccines we need. We've gotten 3 million. So we have a ways to go, but maybe.
That's fair.
Okay.
That's fine. Thank you, guys.
Thank you. Next up, we have Andrea Finney from CBS 21. Go ahead, Andrea.
Good afternoon. I've noticed Walgreens isn't faring quite as well as CVS with vaccinations here in the Commonwealth. 60% of skilled nursing facilities in Walgreens' third clinic and 68% in second clinics for assisted living and personal care. They're still waiting. We are hoping to learn why their numbers aren't on par with CVS or even better, considering it's been 2 months and they have less facilities.
I'm going to avoid letting CVS answer that question. But,
Absolutely.
But maybe, Allison, you want to? Sure.
So I would offer that it may be just a different perspective. I think CVS has been incredibly dedicated in the tremendous amount of resources that they have invested for what is their largest amount of facilities in a state. And so our partnership with CVS has really required them to step up, dedicate not only, are dedicating the vaccine, they're dedicating the resources that are required to actually administer the vaccine. Our partnership with Walgreens continues, and we're grateful for it. I think CVS has just really been outstanding.
Okay, I do have one follow-up. We've also spoken to healthcare associations that represent long-term care facilities about vaccine allocation, and they say up until last week, only 18% of supply was dedicated to the federal pharmacy partnership program. Now, I do realize 63% of Pfizer's first doses were allocated to the program last week. Will we continue to see this higher trend moving forward until these specific vaccinations are complete?
I'll turn it over to Alice, but again, what today is a recognition that actually we've done a lot in the long-term care facilities, nursing homes, patients and staff, and we acknowledge that we still have to come across the finish line, but we've made a lot of progress. So, Allison, you want to talk about that?
Okay.
So we've discussed previously that when we are allocating our vaccine on a weekly basis, the first line, the top line, has been always our long-term care mission. And so we will first fulfill what is necessary, meaning that CVS and Walgreens can actually act upon that week, and then we will have the distribution go to other facilities, healthcare workers, hospitals, and the like. And so our allocation has been consistent with the needs of the program to deliver on their mission, which is meeting those individuals, those residents in their actual facilities.
Thank you. Next up, we have Taylor Tasha from ABC 27. Go ahead, Taylor.
Hi, thank you. I have 2 questions. The first one might be better for Secretary Beam. I know you had mentioned it, but since we did reach this milestone with vaccinating long-term care, do we have a clearer timetable of when we will move to phase 1B, a month that we're targeting? And is it still a realistic goal to get more of the general public vaccinated by this summer? I believe that came up in a press conference over the past couple of weeks.
So as the governor indicated, one of the things we want to be very careful about with that moving to 1B is that when we transition, there is vaccine available to actually have vaccinations. We know that the struggle of 1A right now is that demand is so incredibly high, and we still have a tremendous amount of folks that technically could avail themselves of a vaccine. They are in 1A, but they can't actually access it because we are still advocating for more supply from the federal government. And so we want to make sure that when we actually transition into that phase 1B, which is so many valuable workers that have really showed tremendous dedication to our communities throughout this entire COVID response, that they're actually able to access a vaccine. And so when we reach that point, we will be in a different circumstance for making that transition. But as of right now, we have a lot of folks still in 1A that we want to make sure can actually access a vaccine.
Thank you. And then I have a question for Governor Wolf, if possible. Since the Attorney General said he's not looking into state officials or their policies when it comes to the COVID death in these facilities, is it going to be someone's job to investigate? From the state? Like, who's going to be looking into that?
Well, to say right now, a bunch of people are looking at what's going on in the state. And I guess the group that I control would be the Inspector General, but we're always looking at ourselves, seeing how we can do a better job. So there's a constant inquiry going on as to how we're doing and what we can do to make what we're doing better. So again, I'm very open to anyone who wants to look in. I think I don't control what different independent agencies do in the Commonwealth's government, but it's important that everybody know that in this Commonwealth, this is a democracy, and we need to be transparent and open, and we can all benefit from that. We can be better because we're open and transparent.
Thank you.
Thank you. Next, we have Lizzie Hardison from Capital Star. Go ahead, Lizzie.
Hi, Governor Wolf. Thanks so much for this new Q&A format, by the way. I wanted to ask if you could kind of put the number of vaccinated long-term care residents into a bit of perspective. So you said that, so hundreds of facilities have been vaccinated, but how many residents remain unvaccinated in those facilities? Were all the residents who were eager to get vaccines able to get them? And could you also just kind of clarify, will these partnerships with CVS and Walgreens, are they continuing, or are they coming to an end? Or is the state kind of taking over clinics from this point out?
Okay, let me give you and I'm going to turn it over to the secretary for if I make a mistake here. But when it comes to and keep in mind, there are two different varieties here: the nursing homes, the skilled nursing facilities, and then you have they're regulated by the Department of Health. Then you have the long-term care facilities. They are regulated by the Department of Human Services. The Department of Health regulated groups, the nursing homes, 100% of staff and patients who want the vaccine have gotten it, 100%, the first vaccine, first dose. The second dose, I think we're up to.
First and second dose.
Yeah, first and second for skilled.
Oh, first and second dose, sorry, 100%. So everybody in the skilled nursing. Andreas, why don't you come up and you can give the figure.
Thanks, Governor Wolf. As of right now, 100% of the skilled nursing facilities are completed, first and second dose. By mid-March, all the other long-term care facilities in the state will be completed. So that's the update as far as we stand today through the progress of those long-term care facilities. I'll turn it back over to Governor Wolf.
Thank you. Next up, we have David Wenner from Penn Live. Go ahead, David.
Thank you. The long-term care industry leaders in Pennsylvania, the associations, they're critical about several aspects of the way vaccination among seniors is being handled. One of them is that they insist there's still no plans for vaccinating some other populations of seniors in closely related settings. They give one example they give is independent living. They also give the example of of affordable senior housing, making the argument that these are populations that are very closely related in terms of their age and health characteristics, and also proximity. And they insist that Pennsylvania has no plan for vaccinating them. And then my other question would be, they also insist that the federal partnership calls for 3 clinics, and that's it. 3 clinics, and there's no plan to go beyond that in terms of new arrivals at the facilities. Go ahead.
Yeah, I think that is the federal plan, but we've departed from the federal plan before, and we will continue to do that. I think, as the Secretary said, we where it's needed, we have gone beyond and will continue to go beyond the 3 clinics. The first question is a really good one, and that is we need to make sure that we're not just confining our effort to get to everybody 65 years and older through nursing homes and long-term care facilities, but there are these residences, and so we're working with the area agencies on aging and our Department of Aging. In fact, I had a press conference just last week. We talked about this. So I think 2 things are true. One, we have a plan, but it's a plan that could be made much better, and I think that's a fair point. That we need to continue to look for ways, and we continue to do this, look for ways to get this limited supply of vaccines out to a very large number of people who really want one now. So, Secretary, you want to say anything?
You know it.
Okay, all right. Anything else?
Well, if I could, I would just clarify it goes back to the previous speaker when he referred to 100% of skilled nursing vaccinations being done. Was he referring only to CVS, or did he mean Walgreens as well?
Unfortunately, I am speaking in regards to the nursing facilities, skilled nursing facilities where CVS was participating as the provider. Regarding Walgreens, unfortunately, I'm not familiar with the representation of that. So I think at this point, we can say that the skilled nursing facilities where CVS participated was completed at this time. Thank you.
And if somebody could just then tell us where Walgreens stands, if somebody could.
Hi. So we have actually had similar success in Walgreens. We are having that first and second dose clinics in skilled nursing facilities complete. We know that there are still a mission left to be able to do by way of the 3rd clinics, which folks had referenced previously, and also by way of those personal care homes and assisting living residences. But specifically to your question, yes, those are complete.
Thank you.
Thank you. Next up, we have Jim Melward from KYW. Go ahead, Jim.
Hi. Have you been able to narrow down what caused the shortage last week? It seemed like the message initially was second doses used as first, and then hearing there may have been a systems issue or communications on not holding back doses. Where does that stand? Kind of what was the root or roots of that issue?
Actually, it was all of those things. I think there was some miscommunication. There were some uses of second dose for first doses, and so we got together. The Department of Health and the vaccine task force worked very quickly and came up, working with the consulting team, Boston Consulting Group, came up with a way to address that issue and make sure that that even though there was a slip last week, that no one's going to have to miss their second dose. So we will continue to guarantee that. So, but I think it was all the things that you mentioned. It was, we used some second doses as first doses. There was some miscommunication, and I think we've tried to tighten up all those things and created a plan to allow us to move through this and make sure everybody gets that second dose.
And just a really quick question. You touched on it a little bit, but the process for new residents as they go into skilled nursing, how do you keep up with them and make sure that they're getting vaccinated?
And I'll let the secretary, but that's where we're, looking, if we need to, we'll go beyond the 3 clinics that have been mandated by the federal government.
Yeah. Thank you. So that is an active discussion here, not only for new residents, but also new staff. We want to make sure that the level of protection that the skilled nursing facilities will have at the conclusion of that 3rd clinic can be sustained. And so, as folks have discussed, one of the primary attributes of this mission is that the vaccine goes to the residents, which is incredibly helpful for us, meaning that it's the mobility of it. We want to make sure that to the extent that we can continue having pharmacies play that role and going to nursing homes to have individuals vaccinated either before becoming a resident or before becoming onboarded as staff would be incredibly helpful as we continue to try and fight COVID-19 and especially protect against the spread in nursing homes.
Thank you. Next up, we have Brett Schultes from WITF. Go ahead, Brett.
Yes, thank you so much for having this and for calling on me today. I wanted to talk a little bit about, or learn a little bit about the efforts to make sure that there's vaccine equity, that people from different demographics and groups get a chance to get vaccines. Governor Wolf, I know you mentioned the work with the Department of Aging last week. I asked Aging, and they haven't done anything, this was last week, anything in specific to target people who don't have access, as much internet access or access to social media, or use that as their primary means of communication. So I want to ask on two fronts, really two fronts here. What specifically, and how much money are we spending to target older Pennsylvanians who are at super high risk for the worst outcomes, but who may not be as social media and internet savvy? And secondly, what are we doing to specifically target Black Pennsylvanians who make up, who have gotten about 3% of the vaccines, but have suffered about 12% of the deaths? So on those two fronts, please.
Okay, yeah, that's a continuing question. Part of it has to do with resources. If you recall, in the first round of resources that came out back, I guess, in August, September, there was not a lot of money given to states all across the country to actually roll the vaccine out, which meant that any effort to especially address the needs of vulnerable populations that are hard to reach, there really wasn't much of a provision. This administration has actually, by which I mean the Biden administration, is proposing to make a good deal of money available to states, including Pennsylvania, to do exactly this, to reach out. That money should start coming in March, I think. And so the hope is that we can deploy that. We are still working on the plan for both. We're working with community groups. We're working with the Area Agency on Aging, the AAAs, the centers all around the Commonwealth, and the Department of Aging, to make sure that we do the very best we can. But we still have work to do, and we have to figure this out. We have the resources coming, and we will deploy them to do everything we can to make sure these hard-to-reach populations are in fact reached.
Thank you. Next, we have Flora Pastorero from Penn Watch. Go ahead, Flora.
Thank you. Hi, Governor. Several lawmakers have said that this current system of vaccinating residents is not working. And in fact, they believe we should have a vaccine registry. Would you support something like that?
We're looking for anything we can do to make our system better. That's what the vaccine task force is looking at, how we can do this better. There have been calls for a centralized registration. There have been calls for regional sort of registration. And obviously we've had the calls for the current system where we basically have a distributed network out there. I think when we get to vaccination centers, mass vaccination centers, we will have registration. I think Maryland just launched that today or yesterday. And we'll be doing the same kind of thing here in Pennsylvania. Again, we're open to the best ways to make sure that everybody who wants a vaccine gets one as quickly, as equitably and efficiently as possible.
And you brought up the task force. Is there any reason why you don't have any providers on the task force, that it's mainly made up of lawmakers?
Yeah, that's conscious effort. Actually, one of the first agenda items is to figure out how we bring in more people from the provider system. There are actually a lot of logistics expertise in Pennsylvania. we're working with the state chamber and individual organizations, business organizations to bring people in. We work with education organizations to sort of reach out to say, would you be interested in working with us? I think the way we're going to do this, I like the idea of a relatively small group, the legislatures and me working together to drive this, but we will work through committees and associated task forces where we can actually work with everybody who wants to have a voice in this process, because we really want to hear from folks. And I think here in Pennsylvania especially, we have a lot of expertise in specifically the areas we need for a good, smooth vaccine rollout.
Thank you. Next, we have Bill Kibler from the Altoona Mirror. Go ahead, Bill.
Thank you. To return to the issue about the nursing homes, in light of the controversy in New York, can you talk about the decision early in the pandemic here to bring nursing home residents who went to the hospital with COVID back to the nursing homes when they were discharged? And why did the administration decide to do that? And in retrospect, do you think it was the right thing to do?
Actually, I might be missing something, but the administration did not decide. I think those were the decisions of individual hospitals who said, we need the beds, we need to get the person back to wherever it was they came from. So that was not something that the Commonwealth in any capacity said that we ought to do.
Oh, okay. I misunderstood then. I thought the Department of Health is the one that organized that sort of thing.
Sure, and I'm happy to speak to that. So we actually were abiding by federal guidance from the Centers for Medicare and Medicaid Services, CMS, and the Centers for Disease Control, who advised that we should have patients really heading back to their residence where it could be done so safely. And for our skilled nursing facilities, having these patients discharged to home, that skilled nursing facility is their home. And so we did it, and we did it partnered with best practices and guidance around making sure that those individuals could come back to that nursing home. And we had nursing homes know about cohorting and other practices to try and control for any other spread within the nursing homes. But there was federal guidance put forward that then we had in Pennsylvania to allow that practice to take place.
In retrospect, can you say whether it was a good idea?
We abided by the federal guidance at that time, and abiding by the federal guidance in the role that we play is always one that is most prudent.
Thank you.
Thank you so much. That is all the time we have today. Oh, sure.
I would just argue that one of the things we were trying to do is in the early going, we're still doing, is to try to keep our hospital system from being overwhelmed. And they needed capacity, they needed beds. So I'm not sure what else they could have done. I wasn't aware that was something that we were following federal guidelines on, but again, the idea was to make sure that the healthcare system had the capacity to deal with the pandemic that was unfolding in ways we were not sure back in March and April. Okay.
Thank you, sir. Thank you, Governor, and thank you to all of our speakers. That is all the time we have for today. Thank you to our reporters for using our new Raise Your Hand tool and for all of your questions today. So this will be out on our PA cast shortly. You'll get a full recording of today's press conference. And we thank everyone and hope you have a great rest of the day. Stay safe.